let me, introduce Prem Sai. He's a fourth year MBBS student at JIPMA Pondicherry. His hobbies are reading and traveling, and he loves to play the guitar, and he wants to be a neurosurgeon. So I'm sure you'll have a lot of use for robotics in neurosurgery as well. Over to you, Prem Sai.
It is my distinct honor and privilege to introduce our next speaker, Dr. Ravi Shankar. Dr. Ravi Shankar is a highly esteemed clinical director at Merck Laboratories in the USA, specializing in the field of metabolism. With an impressive career dedicated to advancing our understanding of metabolic disorders, he had made significant contributions to both research and clinical practice. Dr. Ravi Shankar is a pediatric endocrinologist by training, and he works as a physician scientist for MSD. His expertise lies in late-stage drug development, where he designs phase 2B, phase 3 drug trials, and post-marketing commitment studies for metabolic diseases. His work focuses on developing and testing new therapies that have potential to significantly improve patient outcomes. He also happens to be a distinguished alumnus from JIPMA. Please welcome Dr. Ravi Shankar.
So Prem Sai and Ravi Shankar became great friends over the past months, chatting back and forth.
Thank you, Prem Sai. And although it was not slated this way, as the last person speaking today, I have to confess I have a huge imposter syndrome here. After all these very impressive talks. So with that disclaimer, I'm going to just talk about, research in the United States can take multiple different forms. I'm just going to talk about my journey into research, like how did I move into research from a purely and highly clinically relevant training that I had in India. But first I would like to start with thank yous and acknowledgements, most importantly to Radhakrishna and Vidya and the entire Marvelous Medicine on Wheels team. As all of you are already experiencing, they've done a fabulous job. So thank you so much to them, and to the Mahatma Gandhi Medical College for hosting us. They've played a wonderful role here, and all the student volunteers. They've been so wonderful. We had a wonderful, a really interesting dinner with them yesterday. Very talented and diverse group of students. So I wish them all the very best. So with that, the beginning, obviously, the most important thing in my life was when I joined JIPMA. Now, I did not have any exposure to research. MD Pediatrics in PGI, well, I did do a thesis on pica, but as mentioned by one of the previous speakers, it was a box-checking exercise. It really did not, I think Dr. Bala mentioned that. It was just a box-checking exercise. It really didn't teach me much. It actually made me hate the whole process. And again, the case report authoring business. So we did do the same thing, a couple of case reports in the Indian Journal of Pediatrics. And then came my fellowship training in the Indiana University School of Medicine. And that's really where the magic started. So the pediatric fellowship program, the American Academy of Pediatrics, requires 3 years of training with only 12 months of clinical experience, which means that the remaining 2 years have to be devoted to research. So the way my program was structured was that I did clinical work for 6 months, and then the next 2 years was uninterrupted, dedicated research, and the final 6 months was back to clinical work and then applying for jobs and things like that. So the first 6 months, I did have an opportunity to do a detailed literature review because the chief of my section was invited to write a review, an invited review on precocious puberty. And she asked me if I could take a stab at it. It allowed me to learn everything that had been published until that time on precocious puberty. And believe me, PubMed was very useful. It was not the NLM thing that we had to do, go to Delhi for 2 days and sit there in that library and search through those dusty volumes. No, this was done at my desktop, and it was just a very good experience. And, we wrote it up and it got published. This was my first publication with my boss, Aura Peskowitz. And then what happened was the third-year fellow quit the program. So he had just completed a small prospective clinical trial to assess if a low dose cortisol was better than high dose, if low dose ACTH was better than a high dose ACTH test in assessing hypothalamic I mean, in assessing adrenal insufficiency because of hypothalamic dysfunction. So the bottom line was that low dose ACTH test was better than a high dose ACTH test. Basically, ACTH is the only pituitary hormone which is a trophic hormone. So in the absence of ACTH from the pituitary, the adrenal cortex shrivels up. Now, if you give 250 micrograms of ACTH to test that, even a dead adrenal gland will respond to that. So it really doesn't distinguish or help you make that make an assessment. So you need something very gentle, very small. So it stands to reason that a low dose of ACTH would help. So the data had been collected, it had not been analyzed, it had not been entered, nothing had been done. So I was asked if I would be interested in doing that. So in the first 6 months, I took that opportunity, and this was the publication that resulted from that. And again, this started my journey in research. I was totally hooked after this. So the learnings from the first 6 months was how to read literature, examine gaps in knowledge, how to formulate questions, how to test hypotheses, and how to design clinical studies. I mean, the devil is always in the details, like, the sample size, why, what is the effect size that you're looking for, what kind of a sample size will allow you to do that, what type of statistical analysis plan are you planning a priori, the inclusion exclusion criteria in the protocol, creating an informed consent, the admin tasks, painful but need to be done, and taught me patience. The next 6 months, so the next 24 months was research. Of those 24 months, the first 6 months, I asked to be part of a molecular biology lab just because I wanted to learn the techniques. Now, I did that. I completed the whole project that I was given, but at the end of it, I knew that this is not what I wanted to do. I wanted to I wanted to engage in clinical research, not this. So I moved to a clinical research group led by the chief of adult endocrinology, and that was one of the most exciting times of my life. I learned all about euglycemic hyperinsulinemic clamps, hyperglycemic clamps, all kinds of clamps to assess pancreatic function, to assess insulin resistance, using tracers, hot and cold tracers to measure how glucose enters and disappears from the system. We did very complex leg balance studies with catheters in the femoral artery and veins of our volunteers, and assessing skeletal muscle blood flow and also measuring AV differences in glucose. It allowed us to do a lot of studies there. I also learned how to do skeletal muscle biopsies, fat biopsies, and all that stuff for molecular profiling afterwards. Now, Dr. Barron also ran a wet lab, and so I learned to clamp rats and mice, learned stereotactic surgery to place cannulas in the third ventricle of rats, and and some of these led to very nice publications. We also infused an inhibitor of nitric oxide synthase into the ventricle to assess if there was any central control of insulin's secretory function and insulin sensitivity. Again, we had a very nice publication from that. It taught me how to author presentations, because this was the first time we had to present some of these as either posters or oral presentations at the American Diabetes Association meetings or the Endocrine Society meetings. When we wrote up the manuscripts, it taught me how to respond to comments from reviewers. Sometimes you want to call them names, but you need to learn how to control all that and, very politely respond to them. You can't tell them, did you really read the paper? But, you have to be very, very, very polite, and learned more patience in the process. Now, after my fellowship, since I was on a J1 visa, I ended up doing a rural service in a beautiful part of Kentucky called, beautiful but immensely backward part of Kentucky called Berea. So it was a mining part of Berea, of Kentucky. It was an interesting thing where I practiced primary care pediatrics for 3 years and then moved back to academia, decided to pursue a research route, started applying for grants, started with a startup grant from the university, and this was to study what was known as the first meal effect. So if you take people and you give them isocaloric meals, you give them the same meal for breakfast and the same meal for lunch, the glycemic excursions after breakfast are always and significantly higher than the glycemic excursions after lunch. And that is because the gut is not prepared when you first eat the first time in the morning, which is why breakfast has to be a light meal and not a heavy meal. Because if it becomes a heavy meal, your glycemic spikes are going to be much, much, much higher. So, so this whole observation came about because we were doing this study. So the preliminary data for that grant came from this publication where we had looked at meal tolerance tests in patients with early diabetes. Now, this was before the American Diabetes Association changed the definitions of diabetes, pre-diabetes, etc. So that's not relevant, but we noticed this first meal effect there, and then I got a grant to study it a little bit more, and then went on to get a career development grant and other grants that allowed me to have 75% of my time protected for research. What happened was subsequently, I also wanted to do clinical research. So we started a collaboration with Dr. Pratt, who had a lot of data that he had collected prospectively from a cohort of kids that he had followed from when they were young. And this, allowed me to go back and look at it retrospectively and see what happens to blood pressure in puberty. So as you can see, before puberty, everybody is the same. Boys, girls, blacks, whites, all the same. But after puberty, particularly white males have a very significant jump in their blood pressure. Same thing with diastolic blood pressure. Similarly, we looked at blood pressure in the Y chromosome polymorphisms. Again, certain polymorphisms were more impactful on their blood pressure. We also looked at weight in these kids and the onset of overweight, so that allowed me to see that nearly 25% of kids were already overweight or obese before they started school. By 7. So if any intervention was going to be useful, it had to happen before that. So subsequent to that, I moved to Merck. It's my 19th year at Merck. And as Prem Sai explained, my job is to design late-stage clinical trials. And this is basically what I'm going to talk about in the next minute, which has allowed me really to be very intellectually engaged in this process. And that's my biggest, that gives me the greatest joy here. These are a set of publications that I was able to be part of with my wife. We did these very interesting mechanistic studies. These are not typically the kind of studies that you expect to come out of pharma. This is basically because she was part of a group that was called experimental medicine. Their job was to set benchmarks and create platforms to assess new compounds. And in the process, several studies were done, which were then, we were able to published to further science. Now, learnings from this transition. What did I learn? This is the green bars are patient contact. So when you're fully clinical, you have 100% patient contact. That does reduce when you go into academic research, like I was doing in Indiana University before I moved to Merck. When you move to pharmaceutical research, right now my clinical contact is minimal, except when I go to a diabetes camp or something like that. And what happens is the impact, because when you're in clinical practice, all you impact is the patient that you're seeing. With your research, and as it gets published and more people adopt it, it becomes more. And with pharmaceutical research, with each indication or each new drug that comes to market, you're impacting a very large number of patients. So with that, I think I come to my final thoughts. I think what I would like all of you to know is ask questions. be inquisitive, figure out how to pose questions, figure out how to never hesitate to ask questions. And it's not about, hey, I will not know how to answer the question. You can always find out how to answer the question. There are multiple people who can tell you how to answer a question. Very few people who can teach you how to ask questions. So that's the skill that you need to develop. So the most important skill for a researcher, whether it's clinical research, whether it's bench research, is to ask questions. So just let your curiosity run riot, ask questions, and come and figure out how to answer them. And that itself is intellectually challenging and very rewarding. And the process is as exciting as the final reward.
And now I hope you understood why I've been egging you to ask questions from the morning. Because otherwise you're never going to have any research and you're never going to have a publication. So at least now does any student have a question?
Good afternoon, sir. I'm Dr. Hira, I'm a senior resident from Chettinad. I'm also a course coordinator for the postgraduate course known as Clinical Research in Experimental Medicine, sir. So as you had shown, there were so many projects later on you had done on experimental medicine. So I want to know the weightage of how much weightage should we give to a course where I'm training students to, get into research, get into R&D in pharmaceuticals. So experimental medicine, we only teach them for one semester. So the next all semester is on clinical trials and basics and research. So I feel that more impact comes when experimental towards experimental research rather than the clinical research. So what do you think? How this course can be?
I mean, experimental medicine is an excellent way of getting into research. It's almost like doing research on a clinical research center in a university without having to worry about funding. So you can ask your questions. Obviously, it has to have some relevance to what's being done by the company. But for example, one of our problems was that we had just gotten sitagliptin approved. And sitagliptin, as many of you will know, is one of the first DPP-4 inhibitors and the first incretin-based therapy to be approved. It increases GLP-1 levels post-meal. We could never see an impact of it in normal people. We could only see it in patients with type 2 diabetes. But doing studies in normal people is very fast, cheapest, and easier to do. So we had to figure out how can you unmask the sitagliptin effect in a normal human being. And one of the ways we thought we could do it is by raising the normal volunteers' blood glucose. And so we did that. We did a hyperglycemic clamp where we raised their blood glucose levels and kept it at 200 for about an hour, after which we gave them sitagliptin, and there we could clearly see sitagliptin or placebo, and there we could clearly see the effect of sitagliptin. So it sort of helps you think, it sort of helps you understand how to ask questions and how do you, figure out how to answer them. So,
Ravi, I have a question.
yes.
Now, see, you got into research much later in your
Yes,
life.
yes.
Is it possible for second, third, fourth MBBS people to do research? If they have to do, what should they do?
First of all, what I would suggest is to learn how to ask questions and to learn about the basics of research. I wouldn't expect them to be writing grants or coming up with their own proposal or something like that. So if there's someone in the university who's already doing research, sort of work with them, join them on projects and things like that. So, but what I think would be very useful in the curriculum, which I would have appreciated, is clinical research 101. How do you design studies? What kind of criteria do you use? So typically, say for instance, inclusion criteria. It's they sort of say inclusion criteria, you just say anybody and everybody with that particular condition. And it's only by the exclusion criteria that you whittle it down into the particular thing. So the other thing that I wanted to say is the twin of this, or the mirror image of this, is knowing all these things also helps you read publications and understand what they apply to, because not every publication applies to everybody. most of the semaglutide trials were done, and that's the other thing. You can very nicely, play the system too. So there's something known as the ceiling effect, and there's something known as the floor effect. So if you want to show huge defects, so start with somebody who's humongously obese, and you'll see phenomenal weight loss. So everybody will talk about. I mean, the Wall Street Journal will say that they got, they lost 50 pounds or 100 pounds, but they started at 400 pounds, so obviously they will lose that much. So but most people are not 400 pounds. So when you take somebody who's obese, who's maybe 200 pounds, they're not going to lose 50 pounds, they're not going to lose 80 pounds. So that kind of relevance and understanding that needs some understanding of research as well. So
Radhakrishna, you robbed the student of a question. She was going to ask that.
They're all hypoglycemic here, so nobody asks. Like me.
Oh yeah, I did several animal studies. Spent a lot of time with rats and mice and things like that. Learned about the concept of artificial CSF. I once infused normal saline into the brain into the ventricle of several rats and caused untold harm. So before I figured out what artificial CSF was and things like that.
Selecting your patients when you went for human studies, that also in states you were there.
Sorry, say that again.
Volunteers for the studies.
So the way it works for me is that I am not recruiting those patients, right? So I have sites that do them for me. So I wouldn't know how difficult or easy it is. All I know is that it happens at the end. I think Dr. Balachandran had a question.
Encourages research, research among students, fourth years and third year and fourth year, first and second year also, and then they would encourage people to submit for grants, and they do. After all, you see, when it was a medical student who was given a grant to introduce a drug which can prolong the effect of heparin, protamine, zinc, insulin, it prolongs the effect. They thought the same thing will happen to heparin, but to their surprise, they found that it totally neutralized. So it's possible. So that's why. And it was noticed only by the student. So it is possible that they'll come out with some very good discoveries.
Oh, yeah, just a...
In India, for medical students, is a double-edged sword. One is that the interest is not there. I mean, they don't even have an idea. The other is the parents pay the fees. There is no requirement for any of them to be interested enough to earn money when they are studying. When there is a requirement, that interest will come, and then it gets handed over to the next generation and all. As long as parents are going to pay the fees, these kids are not.
Can I just comment on that? I think it's a different thing where you have this ICMR research. Like in JIPMA, when I was a student, hardly one or two people used to do. Now we have more and more of them coming. I mean, for want of future, they all know that research is very important for any recruitment or anything like that, and people are interested in research. It's not that yeah.
To the hospitals and colleges and doing short-term internship projects and all.
Yeah, one of the ways that we at AIIMS Delhi encourage undergraduate students to do some kind of research is by giving them summer projects. When all the other students go home during the vacations, some of the students stay back and they go to the laboratories of various faculty members and they join them with a small summer project. So that doesn't require any additional funds or anything, and sometimes the student also may get paid. So I think it is important for the institute to have people who are doing research, and those laboratories will attract the students. Students may come up with their own research questions, or they may take part in an already ongoing research. So it is important for the institutes to have research going on.
Like in JIPMA, we have something called GJ Straws, where we award some amount to 25 students and it's selected. So yeah, as he said, institutes have to take the initiative.
Absolutely. And, and I also think that when you join somebody's project and you're working on it, ask questions. Ask questions. That's the only way you're going to learn. The answers are not going to become self-evident, so it's not going to happen. You have to ask the question. You have to, and there is nothing called a stupid question or a silly question. the answers may be stupid or silly, but the questions are never stupid or silly. So ask those questions. Ask those questions. Sometimes you'll be surprised by the answers you get. And sometimes you might ask questions that the mentor hasn't thought of. And that, will lead you in a completely different direction, which is perfectly fine.
Sir, on that note, I would just ask one question. As a student, I took up 2 projects in second and third year, and a lot of ethical issues arise when you're starting up. So how do you deal with that? Essentially.
So when you say ethical issues, what do you mean?
So like majorly, sir, like you are not in that position to deal with the patient, or probably like the thing that I faced was the degree is not there, so you cannot pose that question or pose that answer yet. So how to?
So typically, what happens is when students engage in research, they are participating with a mentor who has the required degree or the experience. So typically they do it together, and that's how we overcome those. So for a second, when you said ethical, I thought you had issues from the IRB and stuff like that. And believe me, that is major. I glossed over that. I mean, sometimes IRBs send you more questions than even grant reviewers. So you just have to, that's a whole nother, session by itself. But these kind of things, I wouldn't call them totally ethical. It's probably more practical and administrative, but certainly the mentor and you do it together to overcome that.
The last question for you, sir, from one of our students.
Myself, Swati, third year MBBS student, MGM CRA. Basically, the word research, people are aware of it, but don't know where to start. Like, there is no basics. People don't even know what is included in that. Maybe study designs and all were taught in the subject called community medicine, but people don't usually know what to do, where to start. Like, let's say, sir, we have opportunities in our own college. Researches are going on, but don't know where to get included, who to approach. As in, say, a mentor is a very important person. But then things like case report, literature reviews, review articles. There are many review articles which our own teachers had been doing, and they're posted in the library also. But we don't really know where to start, like the bare basics. What to do, sir? Like, how do we start?
Okay, so the easiest way to start is when you read something in a textbook, at the end of the textbook, there's a list of references. Look them up. Start by looking at them. That will give you an idea what the studies were done that led to being, that led to this part being abstracted into that chapter. That's one very good way to start. That's a very nice way to learn to learn the literature, relevant literature. The next thing is then you can search for similar terms using PubMed or Ovid or whatever system that your institution subscribes to. And as you read more, you will get questions, because you're not reading it passively. You will start getting engaged. Despite you will say, hey, if this happened in this group of people, what about somebody else? This was a study in men. What happens in women? So things like that. So you have to, it will come to you. But as far as understanding what research is going on in your institution, I think your institution would be the best. You can just approach anybody. That's why I said, ask.
Thank you.